So people, an interesting thing happens when you actually diligently study healthcare proxy laws, rather than just skim through them. And my cousin's been diligently studying Massachusetts healthcare proxy laws. Interesting thing happens. You learn all sorts of things, like if a hospital has a patient and outright refuses to transfer that patient elsewhere when that patient's legally appointed healthcare proxy has demanded that patient be transferred, guess what, baby? It's considered abduction. It's considered kidnapping. Okay? And you guys, we all thought, battery. When you think of battery, you think of somebody being beaten. That's what you think of the definition of battery? Nope. Not when it comes to healthcare proxy laws. According to what my cousin read, for a hospital to sit there after one of their patients' legally appointed healthcare proxies has expressly told them the patient's care and wishes, regarding medication, treatment, and whatnot, and they've simply totally disregarded that healthcare proxy's wishes, it's like denying that patient's wishes. It's like forcing treatment that patient has neither consented to or I can't read my own writing. Doesn't matter. It's considered abduction, kidnapping. If a healthcare proxy, a legally appointed healthcare proxy of your patient, if you're a hospital, nursing home, whatever, and you outright refuse to transfer that person, just give excuses, say we don't have to, blah blah blah, whatever, it's considered kidnapping, abduction. Those are criminal offenses. It's considered battery if you apparently, as a hospital, whatever, you're expected to hand over to the healthcare proxy any and all documentation, records, whatnot, that would help that healthcare proxy make informed decisions in regards to the person over which that they're the healthcare proxy. And it's considered battery if you force treatment that neither the patient nor the healthcare proxy consented to. Okay? For a hospital to sit there after a healthcare proxy has expressly told that hospital, the patient's care and wishes regarding medication, treatment, etc., and they just simply disregard that patient's wishes, it's actually like, disregarding the patient's wishes and forcing treatment on that patient that neither that patient, you see what I'm saying? You see where I'm getting at, people? Hospitals need to take healthcare proxy demands and concerns seriously, or they're in deep doo-doo shit. Okay? Those hospitals are in deep doo-doo shit if they just poo-poo and disregard the concerns and demands, etc., of one of their patients' legally appointed healthcare proxies. Okay? And in the event that there's two and they have opposing viewpoints, then that hospital has to seek judicial relief. A judge has to decide what's in the best interest of the patient. Which healthcare proxy has the best interest of the patient in mind, okay? And the only way that a hospital can refuse to do something that a healthcare proxy, one of their patient's healthcare proxies is demanding, such as transfer the patient anywhere else but there, they have to seek judicial relief. They can't just say, no, we're not going to do it and go on the merry way. Okay? Criminal offenses, people, end of fucking story.